what it showed our team is we were calculating our inventory based on an overnight delivery. And we had our inventories wrong because of that calculation. So as soon as we ran those calculations, the team said, we just figured out we were not carrying the right amount of inventory for this supplier stuff. That's interesting, Steve. And it was all because we asked that one question.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
This week on Power Supply, we speak with Stephen Downey, Chief Supply Chain and Patient Services Officer at the Cleveland Clinic. We're going to be talking about a number of things today, but we will kick it off with a focused discussion on OTIF. And if you don't know what I'm talking about, then just stay tuned because you're going to learn all about it in this episode, Hays.
Absolutely. You're going to learn that. You're going to learn the number one sitcom in his mind. You're going to learn what Top Chef is. You're going to learn a lot of things. So come and join, and you'll love it.
All right, we're going to be right back after a short break with Stephen Downey.
I'm Hays Waldrop.
This is Gary Skinner.
And I'm Justin Poulin.
A production of 17 Studios. You're listening to Power Supply.
Joining us now is Stephen Downey, Chief Supply Chain and Patient Services Officer at the Cleveland Clinic. And Steve, we're really excited to have you on the show. I know you are familiar with Hays, and I've been seeing some great content on his LinkedIn page, some videos that you did. And we're going to continue that conversation here on the Power Supply podcast. And so I just want to thank you so much for coming on the show today. It's a pleasure to have you.
My pleasure, Justin. And Hays, the council that Hays put together is an awesome forum for just folks to share kind of like-minded thoughts and collaboration. And I met Hays years ago in doing those events. I think it was at a CEO one, Hays, if I remember right.
I think you're right.
I got great insights from a panel of CEOs that you threw together. And I said, from then on, Hays is a friend of mine.
Well, after today, that might change. But I always like to kind of throw a little curveball to you. And, something that's not related to our business here, but I'd like for you to tell me your top 3 sitcoms of all time. Let's hear them.
Top 3? Well, I'm a Seinfeld fan.
All right, that's a good one.
Knew that was coming.
Gary's been waiting for that one for a long time.
Yeah, absolutely.
I've been a Seinfeld fan. There are so many times in our lives where you run into a Seinfeld episode, and the problem is the older we get, the less people who've watched Seinfeld, and you'll make a reference, and they'll, like at a restaurant reservation.
No for you.
Why do you make a reservation? They're not going to hold the reservation, right? I had that problem with a rental car the other day, and I said that to the person at the rental counter. And they looked at me like, what are you talking about? Never mind.
Where's my car? Yes.
All right, Seinfeld's a good first one. No, we'll go. We need 2 more, though. Come on now.
Well, I'm sure we could find a Cleveland one now that I've relocated
Drew
myself
Carey.
to Cleveland.
Drew Carey Show.
The Drew Carey Show. Yep. Drew's a legend in town here. And Whose Line Is It Anyway? Was one of my favorites that he did. I saw that. They took that on tour. I saw it live. It was phenomenal to see live. I never stopped laughing in that crowd. And then, third, I would say it's Friends, but really it's the nostalgia of what it used to be like to watch shows on a Thursday night, and you'd see Seinfeld and Cheers and Friends, all on like that whole genre of like watching Thursday night television is gone now. But it takes me back to what it was like in the 90s to see comedy.
I know I'm too young for those, but I've seen them on streaming, so that's been great.
You binge watched them, didn't you? Binge watched them on a weekend, didn't you, Hayes? Didn't you?
What's regular TV? I don't even know what y'all are talking about.
I think we have to go with It's Always Sunny in Philadelphia for Hayes' age group.
Okay. All right, so enough of that good stuff here. Now we know who you really are. So let's get started here.
Well, Steve, Hayes tells us that you've got quite a varied background of experience too, which I think having, multiple different perspectives is really an essential sort of skill set or experience base for being successful in supply chain, because you can really understand all the different people that are coming to the table, right? You've got the supply chain perspective, you've got the supplier perspective, and then you really have the end users, throughout the healthcare organization, that all of that needs to converge in alignment to be able to do successful implementations of, conversions or expansions of a current relationship. And I just wondered if maybe you could talk about your background in all those different areas, because I just think that's so critical.
Sure. I think one of the things with you bring your own experience and your own perspective in the situations, right? When you're faced with problems or challenges, here's what I've done in the past or what I know people have done. So you bring your repertoire. And if your only experience had been, let's say, in sourcing, then your go-to is, let me negotiate this as a deal, right? And if it's a value analysis discussion, you're negotiating it from a sourcing perspective, which is great, but I wanted a broader perspective. So I started in med device. I'm an electrical engineer by training, but I haven't done much electrical over the years. I could design a motor back in the day, but now if you showed me one, I would just look like a bunch of parts. But always patient facing, always into the medicine side, but went into med device. And I found I liked the use of the product the most. It was really the most important to me to see something get used. I did a project with neonates to see the impact you could have on a baby that's as small as your hand. Was incredible. But I got a lot of experience in the manufacturing and operational side, sitting across from the FDA, what it means when they say, show me that batch production record with a badge and a gun on, and you're like, oh, here's your paper, as your hands are shaking, handing it to them. But now when I have a recall, like we just had an experience last week, I knew exactly what the manufacturer was going through in that recall because I had just done it, right? I had done it years ago. But I went through the med device manufacturing. I did sales and marketing and commercial operations. I shifted to supply chain, did global supply chain. Then I went to third-party logistics, which was great experience to be speaking commercially about supply chain and then putting in operational solutions. But I also got to see across the healthcare spectrum, there's so many pieces of just healthcare. There's med device, pharmaceuticals, over-the-counter CPG, health systems. Every time you said healthcare, it was like, well, it's which kind of healthcare is it? And every one of those was different. So I got to see how each one of them went at the supply chain challenges, and everybody had different challenges in their industries. And then I got to see how other supply chains worked. Like as we did over the counter into Walmart and Target, I saw what on time in full meant. When you had your first meeting with Walmart, and you didn't have good OTIF scores, and they said, sorry, you can't meet with us. What do you mean I can't meet with you? But then you dug into what OTIF meant. And the first time they said, here's your financial penalty for not meeting your OTIF, you're like, well, I'm paying a lot of attention now. And then I was at the GPO, and I got to see the perspective both from suppliers and health systems. I did a lot of work with health systems, but at a national scale, you saw small, medium, large health systems. Now being part of the clinic, we're doing things like implementing OTIF. But when I do that, when I go to implement that measure, I want to do it the same way that Walmart did it, in partnership with suppliers, along with others, to make sure it's not just our way of doing it, but it encompasses everybody's perspective so that frankly, we all benefit in the end because that's the whole idea.
Lots of people who listen to this are new to supply chain. And so I'm really glad, you're using an acronym like OTIF because that gives us an opportunity to define something. And you also just talked about implementing that. And so I want to dig a little bit deeper on that particular topic and talk about what that's like. But let's set the baseline first. Can you define OTIF and then maybe why it's important and a critical measure to implement?
Absolutely. On time, in full. So it's not just getting what I asked for. It's getting it where I asked for it on the day I asked for it. So if we ordered 100 catheters to show up next Wednesday, that needs to be within my normal production amount. If that is 100 times my normal order, you can't be expected to supply that. But if I asked for it next Wednesday and you shipped me 110, then your score is going to reflect that because you overshipped me. Or if you shipped me 90, right, you undershipped me. But also if you showed up early or late, then that's reflected as well. And what it really does is it sets the bar for making sure you get what you want, where you need it, when you need it. But there's a lot of things that the systems, as you measure OTIF, can show you. I'll give you an example. The first time we said, let's measure a supplier's performance just ourselves, let's pick a supplier and let's look at their orders and look at when it arrived. It showed a horrible on-time performance. And we said, why is that, right? We don't think they're a horrible supplier. Why is it horrible? Well, we had unreal expectations. We had it set that we were expecting the shipment to be next day because we were so trained that everything shows up the next day. Well, this supplier happened to have a farther away warehouse, and when you ordered ground, it took 3 days. Totally a reasonable ask. It's the way it should be. But if you set the metric to measure it with your supplier and said, what is a standard lead time for you? You program it in the system, and then you expect it to show up at the program lead time. What it showed our team is we were calculating our inventory based on an overnight delivery. And we had our inventories wrong because of that calculation. So as soon as we ran those calculations, the team said, we just figured out we were not carrying the right amount of inventory for this supplier stuff. That's interesting, Steve. And it was all because we asked that one question. So then we said, okay, this is a broader topic for us to now measure with the suppliers. How do we know, let's say you say it shipped and we say it received, whose data is right? There's a lot of alignment of information you have to make sure you get, that you're measuring the same metric. I asked for it to arrive on my dock. Did it actually arrive on my dock? Or you just measure that it left your door and you don't know when it's going to arrive. So there's a lot of collaborative building to make sure your on time and full metrics are realistic and shared. And there are reasons that are outside your control, like weather. You have to create exceptions for. Walmart did a lot of programs around how to roll out OTIF and did a lot of piloting with a lot of suppliers over time. I think anybody who is a supplier to Walmart would have found that it helped them in the end. As a supplier, it helps you in the end. And that's the whole idea here, is it just helps everybody in the end.
So how does the scoring work? Is that something that you do internally? Is there an external organization? Is it part of like ISO audits, especially, and it's speaking maybe more on the manufacturer side, supplier side, although I do know supply chain departments that do have ISO certifications, but, how does that whole scoring thing work?
Yeah, you set the metrics yourself. So if we're expecting 100 catheters next Wednesday, did we receive 100 catheters on Wednesday? And that generates your on time and full score. Now, the tough part of it, yes, you have to do the calculations, but the tough part is how do you share that, right? How do you have it so that your suppliers can see their performance? You need a robust vendor portal that, if you're not just generating Excel reports and emailing around, that's really not going to help anybody. But you have a way that you can generate the information and then share it to make sure you're having a conversation about what happened and fine tuning it. And it doesn't do any good if it's just a static reports that's shared 3 weeks later and you can't go back in time. But we set it up in Tableau. It's a metric you can pull usually out of your ERP because your ERP usually has the order and the receipt together, and then the shipment information with it.
Very nice. Hey, Steve, I want to bring it back a little bit. I really love your perspective of the full circle of where you've been and how you shared that to pull it in. And what really always kind of tugs on my heartstrings is the patient facing the mission. I really love that you said that right out of the gate, and you really talked about neonates and where that goes.
He might tear up here. So
Me or Gary?
Hey, I believe in it. I really have a passion for that. I think we miss that a lot of times, and I guess that's where I'm going with this is, we have that fiduciary responsibility from a system-wide level, a global level, if you will, of the numbers. And then, we've heard it all, inflation, we've heard everything. How, in your perspective, with your experience, how are you, or what's your model look like, or how you're balancing mission with that fiduciary responsibility? How do you direct that? How do you get the people involved you need to?
The mission is what drives us all, right? I think if you're in healthcare, you are service oriented and you are driven. There's a lot of extra we go through. I'll tell you a story. Years ago in my past, we had a call from somebody who had an accident and had trauma on their hand, and we're going to lose fingers, and it was a child. And it was like 8:00 at night, and everything is closed, and all the freight had closed, and all the planes were taking off. And all it took was, guys, we have a patient at the other end of this who needs us to save their hand. And everybody rallied. We had people running down the aisles in the warehouse to pick product. We had people holding overnight planes from the couriers, holding them to get the flight on there, to communication going all the way through executive teams on both sides to get it to the health system. First thing in the morning, running it through the halls, save the patient's hand. That level of effort that you go through, like, you need a mission to want to be able to do that, right? And so I always find that I ground myself and our teams and everything we do in the mission. It's about the patients, and we go through a lot every day, right? There's a lot of headwinds in all we do. There's inflation and shortages and challenges, and things happen all the time. But in our world, if you think there is somebody at the other side of this that really needs what we're doing, then you're willing to go through it. So it generally, if you can find the people who are motivated by that, then everybody says we're in, right? And then you become a really strong team, and you focus on the problem, not what is happening at the moment. So when there's a shortage, rather than yell at each other that we didn't keep enough stock, or somebody didn't place an order, or whatever in other industries you might be yelling at each other for, we say, okay, we have patients at the other end of this shortage who need this treatment. What are we going to do? And suddenly you're attacking the problem on the patient's behalf, right? So now you're all rallied around the problem, and you're like, I'll do this. And you get a bunch of experts who say, here's the 10 things we're going to go do to solve it. And now you're energized to go solve it with the mission, right? And it could be a financial problem, could be a shortage, could be anything. And it's grounding it in the mission. I find you get the focus in the right place. And when you start focusing too much on each other, or internal or department fiefdoms or anything like that, you lose that. And I mean, everywhere, anytime it happens. But if you just keep grounding it in the mission, then you'll motivate everybody.
That's a great story about the kid. I love that. That's awesome.
And I also think from a long-term improvement perspective, you're also focusing on the process at that point. What did we learn from this, right? So you're solving the problem in the short term, but you have an eye towards the long term that, wait, where was the bottleneck, or where was the miscommunication? How can we set the process up so that the process itself doesn't fail us again, or it provides a checks and balances for our team, because we know this area of our supply chain is manual, which means it's subject to human error. Or even, hey, so-and-so went out for, surgery, our own team member, and they just happen to have this piece of information that nobody else had, and that's how this happened, right? So I'm assuming that's included in what you're describing there in terms of focusing on the problem.
Yes, and what I do notice, Justin, though, is going from reactive, and when that problem shows up, that you just are solving that problem, to how do we be more proactive to solve this forever? And shortages is one of those areas. Where are the trends or the problems coming from, and how have other industries solved this? I think that's one of the things, and I've heard you guys speak of this before, it's one of the things that healthcare sometimes ends up with the must be invented here because we're so different. That's not always the case. And I think shortages is a great example. Automotive had this problem in the 80s. Automotive ran out of brake pads after an earthquake in Japan and said, okay, they were reactive in that case, but proactive ever since. So we're never going to have this problem. Manufacturers are going to tell us where product comes from. We're going to see each other's inventory. We're going to see each other's production forecasts. We're going to have a common data layer. Okay. And off they went and solved it, right? And so then when we ran into shortage challenges, I asked around and said, how have other industries solved these shortages? And the first thing I ran into was, well, this is how automotive did it. I said, well, that sounds like a great place we can learn. How about that, right? They have $1 million a minute at a production line. So yes, that's the kind of shortage we need to deal with. CPG is another great example. Consumer goods solved OTIF, and other industries have solved vendor management or sourcing technologies or analytics, that kind of bigger problems that healthcare supply chain can absolutely learn from. There are things very unique and different about the healthcare supply chain, but we can learn from everybody else. And great, let's take the best of them, apply them in healthcare. And sometimes that takes outside thinking. Sometimes it takes people with expertise getting with those outside experts and figuring out together how do you solve it.
So you just described something that was a lot about the automotive industry in that one scenario. And what I heard you allude to was transparency. And then I kind of want to take that back over to healthcare and say, I imagine that originally in the automotive industry, there probably wasn't a lot of transparency, but because of the shortage and because of the impact, it was almost demanded at that point. If we're going to survive together as partners, this transparency piece has to be built into how we do business together. Where would you say healthcare is relative, to that example that you gave in terms of transparency? And does that become part of a strategic sourcing initiative? Like, do those become requirements as you evaluate your partners? Especially like we started off talking about OTIF, and I can only imagine what those scores looked like during the pandemic. I mean, it almost had to set a new baseline, I'm sure. And so bringing that back into a strategic sourcing plan moving forward, like where are we on that continuum of transparency versus where we really need to be?
Yeah, Stone Age. I think we are etching it on tablets at the moment.
So true.
What?
Transparency?
Your next question might be why, right? Why are we so not transparent? And where does that come from? Is it fear? Is it fiefdoms or protecting commercial relationships? Is it we don't have a common language that we can talk to? All of the above. I think we saw a lot in other industries when we standardized to UPC codes that everybody could see what was sold where, and suddenly it became a very common topic, and it was okay to figure that out. Healthcare's not there yet. I will tell you the desire is there across the continuum. I've had a lot of conversations with suppliers, distributors, and other health systems about how do we bring in this culture of trust? How do we get more transparent? How do I say, share 6 weeks of surgery forecast, or what's my overall projection going to be for endoscopic needs? And there's much more we can do there. Some of it is experience. Some of it is just not knowing to have that conversation. Now, part of that goes to having the right strategic supplier conversations at the right level, and having the right people at the table who say, okay, your demand planners and your surgical forecasts and your financial teams all should be at the table here from both sides. And when we talk about where our cardiac volume is going to go, sure, we can share. Sure, we can talk about what level of detail with our NDAs in place can we drive to here? And what are we thinking? What are you thinking? And what would that do to our businesses? I remember, Justin, we had to guess lot sizes based on historical purchase volumes, right? And so we would look at X consumption of a product and who had bought how much, and then say optimal lot size is this, and let's go make it. And then inevitably you'd miss and say, what happened? I don't know. Well, somebody was building a new tower, or hired some new orthopedic docs, or was stocking up on their inventory, and nobody had that conversation about why things changed. And if we got better at that conversation, it benefits through the whole continuum. Manufacturers could make the right product, store the right product, distributors could have it in stock, health systems. I want to show folks what I have in inventory. I want it to become a common view. And if you see what's on Walmart's shelf, then you know how much more you need. Why don't you see what I have on my shelf to know what surgeries you're going to be able to cover? So there is a path here, and I think we're on the path. You guys are asking the right questions, because that's what helps elevating the conversation with everybody to say, how do we get here? Frankly, I challenge your listeners, right? Challenge everybody to talk about, how do we trust each other more? How do we be more transparent? How do you understand what everybody's strategic priorities are so that you can align to them to help solve it with each other's data?
So, Steve, is the problem more on the manufacturer side, or is it the provider itself doesn't have the right data infrastructure to do some of that, or is it both?
Yeah, definitely both. Everybody has their own perspective, Hays. So I've got my surgical forecast, or my projection of patient demand, inpatient, outpatient, geography, strategic growth. I can tell what my crystal ball says, and in the next few months are clearer than the next 6 months to a year. But sure, we're planning it. And could we take that to the SKU level to show you for individual items our current on-hand inventory and our current projections? Sure. Do I have the expertise in the system or the time to be able to do that? Probably not. But I bet with the right transparency, we could together work at that, right? And if I said, here's what my procedure cards use for hip, and here's my projections of hips, then we could put the two together and say, here's what we probably are going to use. And that manufacturer could probably say, here's what I think you're using hips, Steve. I don't think you're right, right? And we could talk together and probably together come up with a pretty good answer.
Steve, I'm thinking about what you're talking about, all the forecasting and thinking down the road. Does it behoove us to start thinking about, we're going to hire 3 neurosurgeons in the next year in this system, and start looking at what that inventory is going to increase, or what we need to prepare, or what they actually use, or are they brand new out of fellowship, or do they have physician preference cards we can get to prepare for that? I mean, where does it start? How early are we forecasting? 6 months? Are we trying these 6 months, a year, 3 years? Where are we trying to go with this, and how proactive on from the recruiting side, I guess, to start?
A 6-month window is pretty good notice, right? So if I could tell a manufacturer that I'm going to hire 2 new X-type surgeon, and they're heavy, robotics users, right? And if they're a heavy robotics user, I'm probably going to need something about that. And within a health system, to link together the strategic growth, we need to have more surgeons to do this, to actually bringing in the surgeons, to looping in supply chain to say, make sure you tell your suppliers to go do it. It does require a bit of connectivity. And I think that also comes then to the role that supply chain has in the organization. Does the institute chair over, let's say, the team that was doing the robotics, think of supply chain? Is that in their mind? And well, part of that is, I think, supply chain's job. I think it's my job to reach out and build those relationships and provide that information to those chairs. We had one just this morning with one of our institutes. We talked about capital needs. We talked about supply shortages. They told us what new physicians they were hiring and what geographies. We talked about procedural alignment. I wanted to bring it to them. They wouldn't necessarily think I got to call Steve and tell him I'm hiring as somebody to go do this. They wouldn't think of that. But when supply chain is at the right level of the organization and pushing them to think about what the impact is that they could have on any of these factors, then they absolutely don't mind sharing. I think of that like if you had an expert chef in your house, wouldn't you always eat in the kitchen with the chef, right? You would, but maybe you're just so used to getting delivery every day that you just don't go in the kitchen. So you just never think of the supply chain guy. But then you realize, holy cow, this is a really great service in my kitchen. They can do all these sourcing work. They can do all this data analysis for me. They have supplier relationships. Hold on. I'm going to use that chef. And then suddenly that chef becomes a lot more valuable, and every day you're hanging out in the kitchen, right? The better health systems that have realized that value, then they are more powerful. I was just at a meeting the other day. Supply chain topics have become almost number one with the board. And it is very common now for even health systems to have supply chain conversations at the board level. Which if you asked me 5 years ago,
but that warms your heart, doesn't it?
Right?
Yeah, exactly.
Hays, I need your CEOs to spend a lot of time with me talking supply chain, and they would have been like, sorry.
I think accountable care was moving us in that direction, though, because, I just think the finances of healthcare prior to the Accountable Care Act were such that we could afford to essentially, make some mistakes or not be as efficient. And then all of a sudden the margins got so tight. We were already on this trajectory. We started to see specialization. We started to see differentiation within supply chain. And, obviously what we've gone through over the last, I can't believe it now, but we're going to start saying 3 years here pretty soon, has really elevated that, to your point, because the revenues, now, that boardroom, those C-level, the CFOs have to really be paying attention to this, because that revenue recovery effort alone is still very much underway. So let me ask you this about that engagement and sort of proactive nature, because I'm hearing that in everything that you said too. And as it relates to specialization, is that another area for specialization where you're kind of engaging the physicians in these groups to see where they're expanding and to do this kind of methodical planning? Or do you see that as sort of a general responsibility of a strategic sourcing team? Like, how does that fit? Because I just see structure of supply chain going through a total revolution right now.
Yeah, it's in the sourcing team, and you need your category experts because they're going to challenge you with clinical use cases. And you need to be able to keep up with, okay, where are they heading with this topic, right? But frankly, I think it starts at the top of supply chain, that I'm thinking about all of the aspects of what we do, even in patient support. And part of my world is food, nutrition, patient transport. So as I meet with them, I think about, well, what are the impacts that, let's say, my medically tailored meal program might have on this clinician? Should we talk about what the patient experience side of this is? Because supply chain and frankly, a lot of support services interface with patients. So then you start talking about, how do you bring capital? How do you bring supplier relationships? How do you bring any of the data management side? So it's not pure sourcing, it's not pure category information, but it's across supply chain. I generally find that the supply chain leadership has that scope, so you need to be in those conversations, because if you're not, you end up in a narrow, okay, you're using X or Y, and that's valuable, but it's not as broad as what these folks are looking for. But they're looking for, what kind of automation are we bringing to the patient experience? Or what kind of automation are you bringing to my clinical workforce? Or what kind of shortages are we going to be seeing in plastics for the kind of stuff I deal with? Those are future facing questions that oftentimes you need the right folks in the room to answer.
Steve, this was a fantastic interview. I'm sure you felt like the time went by quickly because I sure did. And we covered something as granular as OTIF as a strategy. And then we went really big picture and took a look at the direction of the industry. And I think you shared some really great best practices, but also some food for thought. And as you said, to continue to challenge the audience, the folks that are listening, to continue to push the industry forward and get involved. And, I love that I see a lot of participation from you on social media. And I want to encourage that because I just think that that's a place where there's so much information that's available. And again, as this industry grows and goes to the boardroom and gets more and more attention, the resources and the information that needs to be available to new talent that's entering the industry is really going to be critical to the success and the future of supply chain. So again, thank you so much for coming on the show.
Justin, Gary, Hays, thank you for the time. It's through efforts like this where we make each other better, right? Rising tides lift all boats. So if we can make each other better, we elevate the industry, then everybody benefits. And in the end, that patient benefits, right?
Absolutely. And I want to be able to eat in the kitchen, like you said. That
I want the executive chef all day long.
Downey. I like it.
That was Stephen Downey, Chief Supply Chain and Patient Services Officer at the Cleveland Clinic. And Gary, I really enjoyed kicking off the conversation with kind of a detailed overview of OTIF and scoring and just some of the measurements that we can do, especially with all the disruption we've been through recently. But then we brought it really back up at a much higher level and talked about, how do you get everybody moving in the same direction? How do you identify passion amongst the team and depersonalize when there's areas of opportunity that are identified so that, the healthcare delivery can be better?
Absolutely. He talked about mission and having that with his teams, they could get anything done. That story he shared about the hand that had been, crushed in the sound like an MVA, that they needed supplies and everybody just went to task to take care of it. That scenario of having mission. It's like, if you have the mission, you'll balance the fiduciary responsibility. But him talking about that was a prime example of where supply chain is and really truly being at the table to help support what we really do, and that's take care of patients. So very impressed. Obviously, he has amazing knowledge, but being focused on the mission was just, really just a touch. And I thought it was a great, great interview from Steve.
All right. Well, that's going to do it for this week's show. But as a reminder, you can help support Power Supply by subscribing on Apple, Amazon, or Google Podcasts. You can also find us on Stitcher, iHeartRadio, Spotify, or just simply search for Power Supply on your favorite podcast application. We've also got bonus content for certain episodes, but you can't get it unless you download our smartphone app for iPhone or Android. And while you're there in the marketplace, we'd certainly appreciate a rating and a review because your feedback is important to the show. On behalf of Hays, Gary, and myself, thank you for listening to this week's episode of Power Supply.